Hi, my name's Debbie Rigby. I'm a pharmacist from Australia, and I'd like to talk to you today around the treatment of chronic bronchitis. Chronic bronchitis is a common condition among smokers and people living with COPD. It's caused by excess mucus production, hypersecretion, and mucociliary dysfunction of the airways. So smoking cessation and optimal management of COPD is the most effective strategy. What we're trying to do in our treatment options for chronic bronchitis is to reduce overproduction of mucus, decrease mucus hypersecretion by controlling that airway inflammation, and modifying the cough. Cough suppressants really aren't beneficial and shouldn't be used, certainly not long term, because they don't act on the inflamed mucous membranes. And therefore really don't have place in acute or chronic treatment of bronchitis. They may be beneficial in people that have that persistent nighttime cough, which is disrupting their sleep. So mucolytics like bromhexine may be useful in breaking up the sputum, making it easier to cough up, but they're largely unhelpful in people with chronic bronchitis associated with COPD. A Cochrane review has shown that approximately 8 people would need to take a mucolytic for 9 months for one extra person to avoid having a flare-up or exacerbation. So they haven't also been shown to have any impact on a person's quality of life or lung function. Some products available in pharmacies will contain both a mucolytic and an expectorant like guaifenesin, ammonium salt, Seneca, or sodium citrate. And these can be used to promote expectoration of bronchial secretions, although they do have some benefit in the common cold, but they've largely not been shown to be beneficial in the treatment of chronic bronchitis or COPD. So for chronic bronchitis associated with COPD, we need to optimise their treatment. And I think pharmacists have such a critical role in helping people with adherence, understanding the benefits of taking preventive therapy, and also making sure that they have correct inhaler technique. So LAMA-LABAs are indicated for most people with COPD, and for people with frequent exacerbations, they may also need the addition of inhaled corticosteroid. For people with chronic bronchitis without COPD, there is some evidence that they may benefit from a short-acting beta-2 agonist, a SABA, like salbutamol, and that may help with relaxation of the bronchial smooth muscle, which helps with the clearance of the mucus. Similarly, there's some evidence, not very strong evidence, for inhaled corticosteroids to help with that bronchial inflammation. And finally, antibiotic therapy is not usually indicated for people with chronic bronchitis, because it's usually viral in nature. For people with COPD and chronic bronchitis, macrolide antibiotics like azithromycin have been shown to be beneficial and therefore may have a role. So in summary, people with chronic bronchitis is usually associated with smoking or prior smoking, and also with COPD. Pharmacists have such an important role in supporting smoking cessation and also optimising treatment and checking inhaler technique in people with COPD. Mucolytics like bromhexine may be helpful, but they're largely unhelpful in people with chronic bronchitis associated with COPD. Thank you.